Over the past several decades, I've done a lot of work in the healthcare sector. That work has been with physicians and physician leaders, with hospital administrators, with pharmaceuticals, with healthcare insurers and others. When people hear that, they often ask me, well, why are negotiation skills important in healthcare?
Well, it might get complicated.
So, if you have ever used the healthcare system, whether it's going to the dentist, or going to get a physical, or needing knee surgery, or if you're a medical professional yourself, you will want to stay tuned to understand why negotiation skills are critically important for our healthcare system. So if you stay to the end, I'll share 3 steps you can take to produce better outcomes for yourself wherever you sit in the complex and gargantuan sector of healthcare. I'm Bob Bordone. I'm a senior fellow at Harvard Law School and the founder and principal of the Cambridge Negotiation Institute. You may notice I'm joining you from a different location right now, and that's because we're in the throes of the Omicron surge. So I hope you enjoy my home office, and I'll be back in the studio soon. So let's start with a reminder of what do I mean by negotiation. So negotiation is any communication, written, spoken, verbal, nonverbal, any communication with an intention to influence or to persuade. So when we think about this definition, I think it's much easier to understand just how central negotiation is to healthcare. Well, why? Well, the entire healthcare system depends on the ability of those involved to persuade. And in healthcare, negotiation can literally mean life or death. Let's just take a few examples. Imagine the relationship between a doctor and a patient. Let's say the patient is in their 50s. Maybe they've been having trouble breathing. Maybe they've sometimes been experiencing some heart pain. So in this example, the patient has seen their family doctor, and after the examination, the doctor decides the patient would benefit from maybe being on a statin medicine and maybe from some changes to eating habits or getting an exercise regimen. So the doctor writes out a prescription for the medicine. So far, you're probably thinking okay, what does this have to do with negotiation? In order for this patient to accrue the benefits of all of the doctor's many years of medical school, the patient actually has to do something. They actually have to follow through with all 3 parts of this prescription: taking the statin, seeing the nutritionist, changing the exercise regimen. Failure to do this renders the doctor's advice pretty useless. And so this is where negotiation comes in.
No applause?
Because it's easy to imagine 2 medical professionals of equal competence, equal knowledge, with getting very different results with respect to outcomes, and not because of their scientific knowledge, not because of their diagnostic capability, but rather because one is just more effective at persuading their patients to actually follow the directed course of action. So negotiation, you see, really matters. And it matters as much for the patient's health as for the doctor's career, because a doctor with better outcomes over time is going to be more highly rated and more sought after and have more patients. I can give you a bunch of other examples in the healthcare context as well, some of which actually relates to work that I've done with clients and colleagues through the years. So for example, consider scientists working at a major research hospital who develop a new technology. Let's say it's a breakthrough drug which might help those suffering from Parkinson's or Alzheimer's. When scientists discover technologies like this, we often celebrate their perseverance and their integrity and their scientific brilliance, as we should. But the story that doesn't get told, and a story that matters as much as the invention, is the negotiation that allows that technology or that discovery to get supported, to get funded, and ultimately to get brought to the market. And unfortunately, for every success story, there is a story of an insight or new therapeutic that gets discovered but doesn't go anywhere.
What does that mean?
And is this because of bad science? Sometimes, but usually not. Usually it's because of a negotiation failure. For example, the scientists might not have had the interpersonal skill to sell their idea, or the startup that provided the seed money wasn't able to persuade other investors to invest in the company to bring the product to the FDA process. And in the end, the therapeutic or the drug that might have had life-saving consequences just doesn't get developed. If you stay to the end, I'll show you 3 steps you can take that'll produce better negotiation outcomes for you wherever you sit in the complex, gargantuan part of the healthcare economy. First, and importantly, work to build trust. So trust is always important in negotiation, but in healthcare, it's especially important. Why? Because persuading a patient to take a medicine, or persuading an investor to pour millions of dollars into a line of research, or helping a loving son talk with their terminally ill parent about dying with dignity, usually means that the person taking the action doesn't have the specific scientific knowledge or background to verify the truth and accuracy of what is being advised. And so they're relying on trust in the wisdom and the goodwill of the person who does have that information. Here's why trust is especially important in healthcare. If I'm trying to persuade you to buy my used car, you don't really need to be an expert in cars to give it a test drive, to kick the tires literally, and see how good the souped up stereo really sounds. You can do that yourself. But if I'm trying to persuade you to take that drug, it's harder for you to test out its efficacy before you actually make the decision, especially if you have no background in science. And to build trust, I want to be open and transparent. I also want to be humble about what I know and what I don't know. One of the biggest challenges we are facing in the United States right now in healthcare is a problem not of science, but one of trust in negotiation. Consider the example of COVID and vaccines. For at least some of those, often described as vaccine hesitant, who have yet to take the COVID vaccine, it's not because they have a different view of the science based on their actual scientific knowledge. Many of those who are declining the vaccine are like me. We actually know nothing about science beyond a high school level.
Takes one to know one, loser.
Now, in my case, I actually took a class in college, a science class that was called Rocks for Jocks. I wasn't a jock, but the class was otherwise a good fit for me. But the point here is that for many who are declining a vaccine, it's not because of their expertise in science. It's because they don't trust those trying to persuade them to take the vaccine. This, it seems to me, is a failure of negotiation, not a failure of science. And so this leads me to the second important negotiation tip that matters to anyone in healthcare. And that is, listen more than you speak. In another video, I'll talk about the value of listening in negotiation. But for now, let me explain why listening matters here. It's because if you are trying to influence someone's choice, it's critical that you understand what would be persuasive to them. And the best way to understand that is to listen to them, to ask lots and lots of questions. All too often, we are prone to explain the reasons why someone should take a particular course of action in ways that are meaningful from our perspective or persuasive to us. But to be honest, in negotiation, all of that is completely irrelevant. In negotiation, what matters is what is persuasive to the person I'm trying to influence. And that requires a huge amount of listening and curiosity and asking questions. And it turns out listening is often in really short supply in healthcare. Not because healthcare professionals are unable to listen or not interested in listening, but often they just face enormous pressures and they don't take the time to do it. A 2018 study by Neka Ospina and her colleagues at the University of Florida, Gainesville, showed that doctors wait an average of 11 seconds while a patient is describing their conditions before they interrupt. Listening well, making a patient or a colleague feel heard, is a critical negotiation skill, and it's one that is just often passed over in healthcare. Now, that isn't always the case. Consider another example from the healthcare context. Some years ago, I was working with a client who had developed wonderful medical technology that demonstrated substantial advantages in terms of safety, patient outcomes, and longevity. Because the R&D to develop this technology, though, was so expensive, its cost per unit was significantly higher than its competitors. But if you looked at the overall cost to the healthcare system over a 10-year span, this new technology would drive substantial savings to hospital networks. Over and over, this client used sophisticated models and data that clearly demonstrated the savings. Over and over, they were rebuffed. Only after good listening did the client learn that the folks with whom they were negotiating were actually not rewarded for driving long-term savings to the hospital network. They were instead rewarded for getting the lowest possible price in that particular contract. So all the data in the world wouldn't change their mind. But only by listening did the client learn that it actually had to be more strategic in identifying influential players within the hospital network who could see the long-term benefit and then change the incentives for the folks who are at the negotiation table. Once again, negotiation meaning life or death.
Which was not stupid.
So stick with me now to the end, where I'm going to share with you some key research on the connection between good negotiation outcomes and good negotiation strategy and the role of both trust and relationships. But before we get into that, let's go to step 3, the focus on relationships and not power. In healthcare, decisions can be extremely hierarchical. Who hasn't heard the story of young residents being bossed around by an overlord attending? It's easy to think if you have the power in an organization, you don't have to negotiate. You just tell people what to do. But this could not be farther from the truth. The more you can build relationships with your colleagues, that is, going soft on the people, even if you're tough on the problem, the more they're likely to actually want to help you. Moreover, research by Jared Curhan at MIT Sloan has shown that when parties report having a strong and trusting relationship with the other side, they can actually get more value in that negotiation, both for themselves and for the other side. Apart from the research, I know that when I'm in an emergency room, and sadly, I've been in an emergency room, I have fared much better when I focus on building relationships with a care team than when I focus on my rights as a patient. More than in most professions, negotiation makes a difference between life and death. Have I said that already? So, when a medical professional fails to persuade their patient to take medicine or lose weight or take a vaccine, not a failure of science, a failure of negotiation. So building trust, listening more, and focusing on relationships are key tools in a negotiator's toolkit. If you want to learn more about these tools, or if I can help you or your organization improve your own negotiation skills, please reach out to me at bobbordone.com or the Cambridge Negotiation Institute. So if you like this video, be sure to check out my video, How to Improve Negotiation Skills. And of course, please like and subscribe so you keep on getting more videos like this. Okay, here's your chance to improve your negotiation skills. Click the next video and keep watching.